Your doctor has prescribed medication for you via the Turbuhaler from AstraZeneca. For the best treatment of your symptoms, it is important to use the Turbuhaler properly. It is important to inhale properly so the medicine can be distributed via the airways to the lungs, where it can take effect. We will now show you how to use the Turbuhaler. Check the use-by date before you start. If the use-by date has expired, return the Turbuhaler to your pharmacy. When you open a new pack of Turbuhaler, activate it by turning the grip back and forth twice in one go. 2 clicks should be heard. A small window is located under the Turbuhaler mouthpiece. When a red line appears behind it, there are approximately 20 inhalations left. When the red line reaches the bottom of the window, the Turbuhaler is empty and you need a new one. It is normal not to see a change in the window after a single dose. Keep the Turbuhaler upright with the coloured grip downwards. The openings in the Turbuhaler provide the flow of air during inhalation. Make sure not to cover them with your hand when you inhale. Turn the coloured grip as far as it will go in one direction, and then turn it back again as far as it will go in the opposite direction. You will hear a click. 1 dose of medicine has now been loaded. The Turbuhaler is now ready for use. Please note that there is no sense in clicking numerous times in succession because only 1 dose can be inhaled at a time. If you do click a couple of times in succession, the dose counter will count it as a used dose. The dose counter indicates that fewer inhalations remain than are actually available. Then breathe out gently. Carefully place the mouthpiece between your teeth and close your lips around it. Make sure that you keep your head upright and that the Turbuhaler is horizontal. Now breathe in forcefully and deeply with the Turbuhaler. You now receive the medicine, but you hardly taste anything. Then remove the Turbuhaler from your mouth, hold your breath for several seconds, and breathe out gently. After use, turn the white protective cover on the Turbuhaler so that it remains dry and clean. Make sure that the Turbuhaler does not become wet when the protective cover has been removed. When you shake the Turbuhaler, you will hear a sound. This is not the medication inside, but an agent that ensures that the medicine stays dry. Therefore, you will also hear the sound when the Turbuhaler is empty. The Turbuhaler may not be cleaned with water. However, you can clean the Turbuhaler mouthpiece with a dry cloth or tissue. The inside is automatically cleaned when the protective cover is removed. You then hear a scratching sound. Store the Turbuhaler in a dry place, preferably at room temperature. Inform your doctor if you take any other medicine in addition to the Turbuhaler. Also inform your doctor if you are pregnant or breastfeeding. If you still have any questions about how to use the Turbuhaler after reading these instructions, contact your GP. If you are unable to handle the Turbuhaler grip due to illness such as rheumatism, the Handy Grip may offer a solution. The Handy Grip will help you to turn the Turbuhaler grip more easily. You can receive the Handy Grip at home free of charge by sending us a request in writing or by email.